Alopecia areata is a condition where your immune system attacks your hair follicles. It's one of the more alarming physical autoimmune conditions because you feel fine and it feels like your body's doing something it shouldn't because everything feels fine and then your hair is rapidly falling out. The typical presentation is when someone loses patches of hair on different parts of their scalp, but it can happen on your body. It can be a little bit more aggressive and severe where you don't just lose a few patches. Occasionally, and very unfortunately, people can go completely bald and lose all of the hair on their head and body. So there's different immune profiles in patients with alopecia areata. There's some with a less severe immune profile and some with a more severe immune profile. The level of and the rapidity of hair loss varies between the groups. The percentage of hair loss that you have in alopecia areata is how we grade the different levels and severity of alopecia areata. The bald patches look like someone just shaved off a piece of your scalp. Usually they're completely bald and they're like coin-sized circles across your scalp. Alopecia areata can affect not just your scalp, but other parts of your body and can also affect your nails. In the nails, you start to see pits in the nails, or the nails can even come off in rare cases where you stop growing nails. You'll get what's called nail dystrophy, where the nail looks deformed and it's not a normal formed nail. We see a lot of, kids with it, teenagers, 20-year-olds. We don't see a lot of people in their 80s developing alopecia areata. Autoimmune diseases generally don't develop later in life, and they don't develop very early in life. It's very important to see a doctor if you start experiencing hair loss because it's often the first symptom of another condition. I think a lot of people do internet searches to figure out why they're losing hair, and they try home remedies, but really if there's an underlying condition and it's not addressed, it doesn't matter what you do. If you don't address that, your hair is not going to grow. So I think it's very important to see a doctor if you have hair loss.